Hey everybody, how's it going? Today I wanted to read this article that I saw on Bloomberg about the pandemic not being over, but we're over it. I actually agreed with a lot of the points that I read in this article and a lot of what was said, and I just kind of wanted to read it to all of you and get your thoughts on it. So this article says, the pandemic isn't over, but we're over it. The beginning of the end of the pandemic as seen from Florida, New York, and Rhode Island. And you see someone here sitting close to the beach. There's a piece of caution tape, and it says, maybe COVID doesn't cross the caution tape. And they're kind of being tongue-in-cheek there, the same way that I am when I go over this outdoor, indoor, outdoor dining thing, where you get COVID if you inside the restaurant, but if you build a structure outside the restaurant that has a door, windows, a roof, and the floor, then you don't get COVID there. So this is, like people are starting to recognize a little bit of this stuff as being arbitrary and asinine. So this says, Joe Nacera, I've just finished a couple of weeks in Delray Beach, Florida, and I have to tell you, it's a whole different pandemic down here. The restaurants are full, the stores are hopping. Waiters and salespeople wear masks, but most other people don't, not even in crowded bars. South Floridians are acting as if the pandemic is over, even though it plainly isn't. Most of my friends in New York tend to view Floridians as idiots, at least when it comes to COVID-19. They're convinced that Governor Ron DeSantis is hiding the true number of fatalities, and that his refusal to impose a mask mandate and his insistence on keeping the economy relatively open are the irresponsible acts of a Trump wannabe. But when you hear from many Floridians, even liberal ones, is a kind of grudging respect. Whether DeSantis was smart or lucky, they don't care. All they know is that Florida's cases and deaths per 100,000 is in the middle of the pack, well below some states that have followed the CDC playbook faithfully. They're happy with the way things are in Florida, which got me thinking to how pandemics end. Maybe what happens is not that the virus goes away or is rendered impotent by the vaccine, but that people simply decide they have to go on with their lives despite the risk. Faye, you live in my home state of Rhode Island, a state that tried to do everything by the book. Tell me, are people still playing by the rules in Little Rhodey? Faye Flam says, yes, Joe. Rhode Islanders are still playing by the rules, and then some. Masks are everywhere. People wear them running and walking the dog and strolling on the beach. What's heartbreaking is that despite everything, Rhode Island has had a terrible time with COVID-19. Per capita, we've had more deaths than Florida. 248 per 100,000 people versus 157. Our cumulative death rate is almost the highest in the country. The only states that have done worse are New York, New Jersey, and Massachusetts. Over the past year, I've learned that the morality tale many people like to tell themselves, that lives saved are proportional to sacrifices made, doesn't necessarily reflect reality. Sometimes the sacrifices can be, well, dumb. Last April, for instance, I was jogging on a path in Providence when I saw a police cruiser speeding towards me with the lights flashing. I wonder what kind of an emergency they were responding to. Then suddenly they were screaming at me through the bullhorn. I was the emergency. Apparently, a new rule had been decreed that we were not supposed to be outside in any public space. This was crazy. Multiple experts were telling me that the one place where you pose no threat is outdoors, far away from other people. But the Rhode Island government's response to the crisis was to close the parks, playgrounds, and beaches. So this person went outside for a jog, seemingly with nobody around, and that was enough for the police to come after them. And this is one of the things that I've gotten into shit with when I talk about this in this channel. I changed the way that I do business. Once COVID happened, I had my employees wear masks. If I go indoors, I wear a mask. If I'm around other people, I wear a mask. It's just, just basic things that I can do. What I disagreed with were the rampant shutdown of businesses everywhere. And then people would typically respond and say, you want people to die. And then one of the things that I would respond with is that when you look at the death rates in the areas that had the harshest of restrictions, they are often higher than the death rates in the places that had less restrictions. It looks like the states that did not go full Cuomo had similar results to the states that did go full Cuomo when you look at per capita death rates. And that's something that I am happy for, because I don't want people to die in those states that didn't go full Cuomo. I want them to live nice, long lives in those states that did not come down on their citizens with a dictator-like mandate that you're not allowed to run in this area by yourself wearing a mask. Because next time something like this happens, I want there to be a record that taking away everybody's freedom it's not even like you trade the freedom and you get a better result in terms of COVID. In New York City, they found that many of the people that were contracting COVID were contracting it when they were staying at home. And at the end of the day, I really hope that the idea that if someone's jogging with a mask on away from other people and you say, no, you can't do that, I don't want that to have a good result associated with it. I don't want there to be something in the history books that says at the state that kept people from being able to jog by themselves wearing a mask away from other people, that's the state that had the best result, because that means that we'll get more of that in the future. One of the most insightful people I've interviewed through the pandemic is an infectious disease doctor in the UK named Mood Sevik. I apologize for butchering your name. She gathered copious information from studies all around the world and from her own patients to try to decipher who was getting sick. What she found was that COVID-19 in the UK was concentrated amongst people whose jobs offered no sick leave and who couldn't afford to miss work, as well as people living with multiple family members in crowded apartments. Those same conditions exist in Rhode Island. Effective interventions would focus on helping those people. A wise friend once suggested a concise definition of science, a method for seeing the world as it is, not as we'd like it to be. Science-based rules are ones that take human needs into account. Stricter rules aren't always better rules. There's still so much that's not understood about why case counts rise and fall when they do, and where they do. What role does climate play? Why did cases fall everywhere from mid-January to late February? Science doesn't support attributing all these changes to outdoor masking or lack of it, but it's easy for the media to generate outrage with footage of unmasked people on a Florida beach. Joe, I just took a look at the latest list of the states with the most cases per capita over the last 7 days. The top 10 are all what I like to call, somewhat facetiously, the law-abiding states. Michigan, New Jersey, New York, Connecticut, Delaware, Pennsylvania. Talk about proof that we really don't understand why case counts rise and fall. I'm now back in New York, where I've been a little less vigilant about wearing a mask because I'm vaccinated, and boy do I get dirty looks, even when I'm in the safe outdoors with my dog. One recent article you pointed out to me talked about Rhode Island's population density and its poverty, but also the fact that people were still holding get-togethers of 15 to 20 even as the virus spread. The author quoted one doctor as saying, people weren't willing to live differently during the pandemic. I think the way I'd put it is, after a year of dealing with the pandemic, people aren't willing to live differently anymore. Restaurants are filling up again, some music venues are opening, people are booking air travel in numbers not seen since before the pandemic. There are lots of reasons for this, I think. One is that the human species can adapt to almost any circumstance. Think of the British enduring daily bombings during World War II. At some point, people decide that they will carry on with their lives, pandemic or no pandemic. Another reason is that despite restrictions that have taken a terrible economic and social toll, the pandemic hasn't been contained, which makes continued following restrictions feel a little pointless. And this is another point that is an interesting one to me, because there was this piece of news from Ontario where they said it feels like a kick in the gut. Ontario retailers react to another lockdown, and they saw this as horrible. If you scroll down here, it says this is an unbelievable kick in the gut when we heard this. That was the initial reaction and I know it was the initial reaction of so many people. We are destroying a whole segment of the economy. We have been labeled as the non-essentials of the economy. And for the first time in my personal life, that's exactly how I feel. That we are the throwaway companies. If we all disappear, nobody cares. That is how our entire sector is being treated, as if we are disposable. And of course, that isn't true. And of course, I agree that that isn't true, and that people shouldn't be treated as dispensable, and that the government choosing who is and isn't essential is, in my opinion, and always has been, a giant crock of horseshit. This is one of those things where, when you look at it, it would be one thing if you felt like you were really crushing just the curve. But when you look at the areas that have had the most in terms of restrictions, they wind up being the places that often have the worst per capita rate. The third reason, I think, and I would love to hear your thoughts, is that the messaging we've been getting from the Centers for Disease Control and Prevention have been so contradictory that many people simply don't trust the government's advice anymore, and therefore, they're much more willing to just ignore it. Faye, the signs are everywhere that the pandemic is winding down. Even if the virus persists and the CDC keeps preaching doom, the pandemic will end for social reasons. There can be a social ending to pandemics, while the biological risk still lurks. People just start to accept a certain risk and go on with their lives. That even happened during the 14th century, when the bubonic plague ravaged Europe. The COVID-19 pandemic may have already had a social ending in Florida, and it will end soon in the rest of the country, because people were told vaccines would end it, and they plan to go back to normal after every adult who wants a vaccine can get one. I've had some great talks this year with risk communication consultant Peter Sandman. He sent me an email recently that summed up our current situation perfectly. People have spent the year complying as best as they can with recommended precautions, wearing masks, staying 6 feet away from others, avoiding indoor events and crowds, canceling travel plans, and just to add to his list, the complete and utter destruction of their business and economic livelihood with minimal help from the government. All along, they assumed that vaccines would replace this menu of burdensome non-pharmaceutical interventions. Now, they're told that after they're vaccinated, they should nonetheless keep taking most of the precautions they've been taking for a year already. That doesn't feel like just a betrayal. It feels like an exercise in futility. Unless the vaccines start to fail in a spectacular way, Rhode Islanders and New Yorkers will probably start to act like Floridians soon. And this has been what I observe. I went out with Erica last night. We went for a ride around Manhattan. We went to the East Village area, and it really is starting to look like it did pre-COVID. And, again, you have the same mask scatter pattern here that you have almost everywhere else that I see. You'll have one person wearing their mask. You'll have another person wearing it below their nose. You'll have another person wearing it on their chin. And then you'll have the fourth member of the group that doesn't wear it at all. Virtually anywhere you go in New York City, you will see this classic scatter pattern if you have a group of people. Person wearing mask like this, person wearing mask like this, person not wearing it at all. Honestly, that's very much what I saw in the beginning of the pandemic. I wear it above my nose and I'm around other people because, just if you're going to do it, then why bother if you're not going to do it properly? And this is the scatter pattern that I see consistently through. And if you go to the East Village on a Friday night, ain't no 6 feet of social distancing happening there. I agree, vaccine optimism is starting to overwhelm any and all cautionary advice, which I think is fine. In the end, it is the role of the scientists to tell us what risks are and how to mitigate them, but it is the role of the politician to make risk-reward calculus, to decide how much risk is worth it to keep the society functioning. At this point, even if there is a fourth or a fifth or a sixth wave, no governor is going to call for a lockdown. The citizens have made their own risk-reward calculation. And this is something that's very important. I believe in science very much. I believe in science. I believe we should listen to scientists, but at the end of the day, if a scientist is attempting to solve one problem, let us reduce the rate of COVID cases as low as humanly possible, they are focused on reducing the rate of COVID cases so that it's as low as humanly possible. They're not focusing on every other societal side effect, whether it be social unrest, economic instability, domestic violence, feelings of hopelessness and despair that lead to suicide, and erratic behavior amongst what used to be a normal population of people. That is the job of the politician, to weigh these things and to figure out what to do with what a scientist tells you. I've been vaccinated for about a month now, and it feels liberating. I'm ready to go back to the office, eat in a crowded restaurant, hear some live jazz, and visit a museum. I'm yearning for some measure of normality. I even gave someone a hug the other day. He was vaccinated too. It still amazes me that vaccines were ready to go less than a year after COVID-19 hit our shores. That was no small thing. For everyone's kvetching about government's response to the pandemic, vaccines are something it got very right. And we will see how that goes. And honestly, I enjoyed reading this article. I enjoyed reading this back and forth because for once it just wasn't something that just talked about the absolute evils and horrors of anybody that in any way, shape, or form has doubts on the, how to put this, cost-benefit analysis behind doing continuous further lockdowns into the future. They actually looked through and they showcased that the areas that it wasn't obviously direct correlation, but you have areas that had very, very strict, highly strict measures, and they did not seem to do amazingly better than areas that did not have those measures. Now, again, does this mean that I'm going to go to a large room with a bunch of crowded people without wearing a mask while the pandemic is still spreading? No, but at the end of the day, I'm not the kind of person that goes to crowded spaces anyway. I'm an introvert. Am I not going to wear a mask at work? I mean, I'll probably wear a mask at work. One of the things that I've said many times in this channel is the risk reward. If I am wrong about masks, we will look back on the last year where I spent a few dollars a day on masks for everybody and laugh at how stupid we looked in pictures. If I'm right about it, then I will have avoided paying 5 or 10 or 14 people paid sick leave while they're out sick for a week or two while I'm not making business income, which would cause me to likely go bankrupt. So the cost-benefit analysis was in favor of me having everyone wear masks, change the way the storefront is at the front so we had a little bit less contact with people in the beginning times of COVID, cleaning everything a little bit more. But that my risk-reward analysis was such that was what I was willing to do. It was not shut down your entire business, because in the beginning, it was not clear at all when Cuomo made his pause order whether our type of business applied. I did a video about that about a year ago when it said, a tech support for city technology services or whatever, or technical support for technology services or something. I forget exactly what the wording was. It was very unclear. Does that mean someone that's maintaining the city's website? Does it mean us? And I just went to my staff and I said, if I'm more than happy to pay someone to stay home if they wish to stay home at this time, just keep in mind that if all of you do that, in 2 to 3 weeks, I'm bankrupt. So what should we do? Because I really don't want to go to work at a U-Break iFix once this pandemic is over and wear a fucking name tag. And I don't know, I don't think any of you want to either. If you go to Craigslist or Monster or look at what the positions pay at any of these other repair companies, and then you look at what you get here, it's probably going to go poorly if we all are stuck going to a U-Break iFix a year from now. And we came up with something that made sense for us. People that were worried stayed home. Again, the funny thing here is that the first person to get COVID at the store, I shit you not, is the person who was staying home because he was afraid of getting it and giving it to his parents. Since he was staying home for 9 or 10 hours a day that he used to spend going out, going to the gym or something else, since he was staying home and in close quarters with family members that he usually is not in close quarters with for the entire day, his family member, his mom, gave him COVID. So it's just one of those things where you take measures and then you look back a year later and some of those measures not only wound up not being the best thing for the economy or people's mental health and well-being, but in many ways wound up not even being the best thing to do for the actual pandemic. And then, so I'm kind of in that middle ground where people that are, the people that will wear a mask when they're alone inside their car or give people dirty looks in the beginning of the pandemic because they were jogging through a park by themselves with their mask don't necessarily like me. But then also the people that are like, wearing a mask is for pussies. Why would you even bother doing that? This is just the flu. Also tend to not like me. So I'm kind of like in that middle area where people over here think I'm being ridiculous and people over here also think I'm being ridiculous. But, I looked at everything that was going on. I looked at the numbers. I looked at the figures. And I did what seemed to work for me and the people that I care about and have responsibility over. Let me know what you think of this article. I will link it down below. I thought it was a fairly well-done article, well-done interview. And I'll talk to you all in the next video. That's it for today, and see you next time. Also, as always, Mr. Ducky says bye.